Thanks so much, Allison. Congratulations on the progress so far. Our last panelist is the one who brings both gender diversity and non-Allison, non-Kate diversity to our panel. Nand Wadhwani from HealthPhone will talk to us about a really amazing, already scaled, and further scalable solution for getting health information, especially to women in low-resource settings using mobile phones. So, Nand, welcome.
Thank you. Good afternoon, and thank you all for being here. Not quite. I'd like to start with a story, if I may. Many years ago, I was visiting one of the villages in India, and UNICEF had arranged for me to meet the local rural population, and I'd been doing that for several months. And in this particular visit, I was speaking with a group of villagers about water harvesting and filtering and solar disinfection of water. That particular morning, the gathering of women was rather somber and not the lively, jovial neighborhood women getting together. So about half an hour, 45 minutes later, after I finished speaking with them, I asked the local leader, who was my host, why was so quiet, and she mentioned that a rather popular young lady who lived in the village, her child passed away the night before, and everybody was rather saddened by that. And so I asked to visit with the lady and the household and give my condolences. And so I went, and the lady was in her house, which is the little hut, and she was sitting on the floor, and I asked what had happened, and I was told that the child was sick and through the night began to vomit, and then in the early hours of the morning passed away. And after a couple of questions with the local health individual, I found out that they diagnosed her as dying from dehydration caused by diarrhea. And as I saw that, I saw the child's mother sitting on the floor in a small hut, and to her right was her kitchen on the floor, right there. And in the kitchen, there was a bottle of salt, and there was another bottle of sugar, and there was some water. That child did not die from dehydration caused from diarrhea. That child died from her lack of her mother having the knowledge to be able to sit back and to save her child. That's what that child died from. So we go out to our stores and we buy toasters, and you put 2 slices of bread and you push a button, and 20 seconds later 2 slices of toasted bread come up. But when you buy that box, inside that box is a 8-page manual in 8 different languages that tells you how to put 2 slices of bread in a toaster. You go to buy a computer and a mouse, and you'll find, another 8-page manual with another 8 in 8 different languages that tells you how to use a mouse. We have a woman who's getting pregnant, goes through 9, her whole body is changing. We give her nothing. We don't give her an instruction manual. We give her nothing. Something very wrong in the way we look at health in this world. And then we wonder why we have so many what we call preventable deaths. We wonder why. So, as Elise Greenslade said very eloquently, the more educated the mother, the less likely her child is to die. Very clearly. That is at the heart of being able to, that is where we can prevent our deaths, by educating the mother and educating. And there is a huge gap out there. There's tens of thousands of our children are dying and women are dying, mainly because of lack of basic healthcare knowledge. Um, Simple examples like the one I just gave you, or another one of breastfeeding alone that David touched earlier on. We can save many children's lives by just making sure that the mother has the right information. And currently, how does she get that information? Perhaps a health worker invites her and 15 other mothers to come under a banyan tree some afternoon and get some knowledge. And then she goes away, rushes off, and goes back to work wherever she was. Those health workers are reducing. We're going to have a huge shortage. According to WHO estimates, 18 million we will be short. So then how will these mothers get the knowledge? How will they? And how is it that we have this expectation of reducing infant mortality when we don't have a way to give the knowledge to the mother? How can we? How do we pass that knowledge on? So mobile phones allow us an unprecedented way, a way we could never even dream of 10 years ago, to be able to pass on knowledge to them. Nobody ever thought that they would be embraced so quickly. Nobody ever thought that they would drop in price so quickly. Nobody ever thought that they would be able for them to be able to use a complicated device so quickly. Nobody ever thought that they would be able to change behavior with those so quickly. All of that is possible today. All of that. And we are able to really handle issues that we could never before. Like a mother had no way of telling her daughter, come, sit down beside me and let me explain to you about menstrual hygiene. She had no way. She herself didn't have the knowledge to be able to explain to her daughter about HIV, about breastfeeding, about sexual abuse, about many things that she had no way to talk to her. Now she can, on a little inexpensive little phone, $10, $12. They're everywhere. She can sit back and watch, learn, share, teach. She can do that very, very easily, and I'll show you in a minute how you can do that. So we in India launched a program on nutrition, and nutrition touches 12 different of the 15 SDGs. The top 4 being in the area of gender equality, health, hunger and nutrition, and of course poverty. Then it touches on the other ones, but those are the 4 key ones at the top. And touching on nutrition, the key area was really in the area of breastfeeding, because we could save and prevent the deaths of 823,000 child deaths every year, right? If breastfeeding was adopted. I mean, that's a large number there. And these are from the Lancet, this year's report. So, I mean, and look at 300 billion every year we could be saving. So there's an enormous saving here. There's an enormous of lives and economy. And you don't have to go out and buy anything. It's right there. So the idea is to promote it and to let them know the value that we have failed. We have failed in supporting the mother. We have failed in being able to help her through the issues that she had when she can't breastfeed immediately. We have failed her by not having adequate support, and so we have a way to be able to do that. And the key areas are to tell her about the right diet that she needs to have prior to delivering her child during her pregnancy, to teach her that colostrum is best and not to throw it away like it is done in many parts of India at the moment, old customs. That exclusive breastfeeding for the first 6 months, no water, no nothing. And then from the 7th month on, we get into a nutritious diet, including with breastfeeding. So just get those 4 things right into it. Um, so we got a private, public-private partnership, and we had the Indian Academy of Pediatrics, the Ministry of Women and Child Development from the Government of India, and then we had Vodafone, who was our corporate supporter, UNICEF, and HealthPhone. So we got together, and the idea was to be able to deliver knowledge right directly into the hands of the mother. And this was obviously not getting into the hands of the extremely poor who didn't really have a Vodafone account. So this was going out to 185 million customers of Vodafone. And that's what, so did I skip a slide? Hello? Sorry, okay. The Vodafone is giving a 10 rupee incentive if you watch the 4 key videos, and to the 180, and they're publicizing it to 185 million of their customers. 1 million messages every single day. That's 300 million for 300. Thank you. 300 million messages for the next a year for 3 years. So you're looking at close to 1 billion messages that Vodafone is going to be sending out to the 185 million customers to encourage them to watch these videos. And these are 4 videos, each is about 2 minutes long. And this is the video that promotes sorry. While we're getting that on, so the India with this very diverse population, the videos are being shown in 18 different languages, where we reach pretty close to about 85% of the population with our 18 languages. Thank you.
कुपोषण यानी सही पोषण का ना मिलना। गर्भ से लेके जन्म के पहले 2 साल बच्चे में इसका सबसे ज्यादा खतरा होता है। आज देश का लगभग हर दूसरा बच्चा कुपोषण का शिकार है, यानी शरीर और दिमाग से कमजोर।
As David had mentioned earlier on this morning, we're working with beginning the government on the Women and Child Development to work with the Education Department on one end, and on the other side to work with the Water, Sanitation, and Hygiene on the WASH side of the program. But within the program itself, we also have the different phases are in place. We have the first phase, which I spoke to you about, was the mobile delivery by Vodafone. The same videos are available for download from the website and from Facebook, promoted there, and Twitter, and on the radio for audio right across India, and to be viewed on YouTube, available on a micro SD card like this, that you can put it into your phone, and without connectivity you can sit and watch it. Billboards right across India have the message, and again on the website, as I said, you can download them in 4 different formats depending upon the device that you have. Mobile apps in 18 different languages, again, for people who have smartphones and without connectivity, and recently a website on breastfeeding specifically that health workers can then turn around and download the information and receive an email on a regular basis to keep up to date on new issues on breastfeeding. So a completely integrated program. HealthPhone has over 2,500 videos. That was on breastfeeding in 77 different languages that we can implement. And simple, you just watch a video, you just go to your menu, watch it, select a video. Simple. And it's a little story, the Indian Bollywood kind of story for India specifically. So that's, we partnered with all the key organizations for content and for technical and for language. And the library continues to grow. More and more videos are being developed. Languages, 78 languages covered at the moment, and they're expanding to as more becomes available. And there are 2 areas that we really need to work on. We need to get more governments involved, and we need to get more mobile network operators and manufacturers involved, and telephone manufacturers and handset manufacturers involved. Thank you.